so I'm going to be doing an abdominal dressing change. So for this, I would have an order, but for demo purposes, I'm just going to go with it. So I'm going to wash my hands. I'm going to do my entrance safety check. So checking that the bed is at the lowest position, patient's not in distress, he has his cowbell. If he had an IV, it'd be running. So hi, I'm Anne-Marie. I'm going to be your student nurse today. Just going to compare your wristband with my order just to see that I have the right patient with me. Can you state your first and last name? Perfect. And your date of birth? Great. Check your FIN number. Do you have any allergies? No? Okay, so I have an order stating that we're going to be changing your abdominal dressing. I'm going to clean it, I'm going to assess the wound, how it's healing, and then I'm going to apply a new one. Is that okay with you? Yeah, and did you need any pain medication before I get started? No, so he doesn't need any pain medication. So I've gone over that. I'm going to wash my hands, I'm going to set up my sterile field. So his bed would be at waist level position, mine would be at waist level position. All the materials would be brand new. From the supply closet, no perforations or expirations, but for demo purposes, I'm just going to use what I have. Wash my hands, and then I'm going to set up my sterile field. Right, and I have placed an absorbent pad on the patient just because I'm going to be irrigating. I don't want it to splash over his bed, so I actually don't need the sterile drape. Garbage. Is it okay if I place the garbage at the end of the bed here? Yep. And then I'll position him after I set up my sterile field. So then I'm going to pour in my normal saline. So the order would state what I would need. So in this case, it says normal saline. I'm going to put in my other supplies, so checking that there's no perforations or anything like that. So a 30 cc syringe. And then my Cathlon, so it would be in an 18 gauge needle or whatever gauge needle, but I don't have a lot, so I'm just going to use the Cathlon that I have. Dropping it in. And then my Curlex, so in a clinical setting it would be sterile Curlex, but for demo purposes I just have clean Curlex. And then my Q-tips. And my sterile scissors. Put it in the sterile field. Right. So my sterile field is all set up. I'm going to put on my clean gloves and I'm going to assess the patient's dressing and wound. So bed at waist level position, I'm going to leave him lying down just so that I can assess the abdominal wound better. So I'm just going to pull down your gown slightly, maintaining privacy. Right. So it is 40% serosanguinous exudate. There is no smell, so no signs of infection. There is slight shadowing on the wound as well. So I'm going to discard that. I'm going to grab my forceps and I'm going to take out the packing. So we'll also say assess it, how much, so we'll say 40% serosanguinous as well, also no smell. So I'm going to discard that along with my forceps. And I'm just going to assess the wound bed in general. So I do see that it's 100% granulation tissue. I don't see any slough, eschar, or anything like that. The wound bed itself is very moist, it's not dry. The peri-wound is free of inflammation, it's not red, so I don't see any signs of infection there. I'm just going to go ahead and I'm going to measure my wound as well. So in terms of length, 13.5 centimeters, and my width, 3.5 centimeters. I'm just going to assess the depth. Three centimeters. So I would document that. Alright, just going to remove my clean gloves. I'm going to wash my hands once more and I'm going to put on my sterile gloves. So in a clinical setting, I would probably find somewhere on the bed to put my sterile gloves. So keeping them above waist level, discard that. That would all go in the garbage. So now I'm gonna start irrigating my, you can go over here. I'm gonna start irrigating. So I'm just gonna grab a little bit of normal saline. In a clinical setting, I'd probably grab a little bit more. And then my Cathlon. So take off the cap, safety mechanism, it would retract, and then I would just have my Cathlon. That would all go in the sharps. Just going to rearrange this here. So I'm going to attach that. And I'm going to start irrigating from cleanest to dirtiest. So until it runs clear. So I do see that it ran clear, so I can begin drying. Start with forceps. And I'm just going to dab it in the wound instead of sliding it or anything like that. Just let it all soak up. Right, so that basically soaked up everything. I'm just going to clean the peri wound now. So making a crescent shape so that I get top and bottom. And then I'm gonna dry it. If there were probably more crusts on it, then I would probably clean it a little bit more. In this case, it's fine. Right. So wound bed and wound peri wound are cleaned. I'm just gonna assess it one more time so we don't see any tunneling or undermining as well. It's still the same before 100% granulation tissue. So I'm gonna go ahead and start packing my wound with the Curlex. So I'm gonna use that much. I'm gonna soak it in the normal saline as per order. Wring out the excess. Okay. And I'm gonna start packing. Making sure I don't touch the peri wound, even though I did clean a little bit of it. I just don't want to touch so much of it and contaminate my packing. Making sure that it's not too tight and not too loose because I want it to heal. So far so good. Leaving a little tail there. Right. So it's all packed. Looks good. have my tail there for the next nurse to pull it out nicely, so I'm going to discard that. Order says to put 2 4x4s, so I'm going to do that as well. Right. So now I am considered clean. I'm just going to remove my gloves. Could probably put on a new pair of gloves if I needed. Wash my hands, and I just need to put on the Mefix. Just because with the sterile gloves it's kind of hard with the Mefix. Wash my hands again. I'm gonna put his gown up, put the bed in lowest position. I'm gonna leave your cowbell here. If you have any concerns you're not feeling well, let me know. I would clean all this up. It would go in the garbage and the sharps container. Bed at lowest position. He has his cowbell. He's not in distress. His IV is running. So then I just have to document. So I would document in the IP and our flow sheets. So the old dressing was removed, 40% serosanguinous, no smell, 100% granulation tissue, peri-wound free of inflammation, no redness, irrigated with normal saline, and then I would state what materials I used, and then my measurements as well. Packed with the curl-leg soaked in normal saline as per order, 2 4x4s placed over top, with Mefix secured. Patient tolerated well, no analgesic was required, and that's it.